So we're in World Gym Cincinnati in Westchester, Ohio. This is a place that I have been now for about 2 years working out. They know that I work at Beacon. They know that I like to train here. If somebody has an injury, they come up to me, or they come see me in the office.
Hi, I'm Rebecca Powell. I am the owner of World Gym Cincinnati. I am also an IFBB Pro. In 2020, I actually started having some pain in my hamstring, more so when I was squatting or doing exercises like deadlifts, things like that.
My name's Rob Quimby, and I'm general manager and been Rebecca's trainer for probably about 10 years. She was really starting to have some sciatic pain. At least that's what she thought it was. It wouldn't always hurt her. It would come from time, but when it did hurt, it was terrible.
Mentally, bodybuilding is not easy. We have pain, we're used to it, but there's a time when you can push through and then there's a time you shouldn't push through. And it got to that point where I was like, okay, I can't do this anymore. That's when I had the pleasure of meeting Dr. Matic.
She had a tear to the adductor tendon as well as a partial tear to the hamstring that was pretty high grade. And I know what she likes to do. She likes to work out. She was a pro at one point. She did end up going under surgery, but unfortunately did not get the relief that she was really looking for. And so that's when we kind of sat down, we kind of regrouped and said, what can we do to try to treat this? And so that's when we came up with a treatment for the biologics. And we did a combination of a bone marrow procedure in addition to a platelet-rich plasma procedure. When you think about biologics, you think about platelet-rich plasma or PRP. You think about bone marrow aspirate concentration. Those types of procedures are non-operative treatments for some of these orthopedic injuries. We've had great success, throughout Beacon Orthopaedics, but also, here at this gym with some of our members.
I was a little, apprehensive. We're always apprehensive. There was some pain involved with it, but it wasn't anything like unbearable at all. And after that, I was like, that's it? That's all we're gonna do? And then I had to rest. That was the hardest part for me, was resting, because I don't like to rest. Things just started, I could feel it getting better, and things were starting to progress. I was thrilled.
I was very impressed. The pain just seemed to disappear after 2 or 3 months, and then she wouldn't have any pain. I was pretty amazed by how fast it healed up and got better.
I credit a lot of her recovery to the physical therapy team that we have at Beacon, and then bringing her here back to where she likes to be, in the gym, working with those trainers, really allow her then to kind of move forward in her recovery. And luckily, a year later, she's still doing great, still doing what she likes to do.
I swear by it. I've sent several people to see Dr. Matic because of it. They're like, how are you fixed? And I'm like, Dr. Matic fixed me. But the PRP is amazing. The small amount of pain in that 6 or 8 weeks that we were, I had to sit and rest, so worth it. I couldn't be happier.